Okay, so a lot of these perceptual phenomenon, they have been studied, or at least the neural correlates have been studied because there has been patients who are actually suffered from certain types of visual or perceptual disturbances. One of them is called visual neglect, hemiagnosia, or hemispatial neglect. And this is often caused of a lesion in the parietal lobe of patients. And the way that it's experienced, or you can sort of test for it, is that, for instance, you present a model of something that the subject has to draw, and then you ask the patient to draw these images, and you will see that they actually seem to neglect all the left parts of these images. So they only draw the right part of the watch and of the house and of the flower here. And also, if you ask them to make a small draw a small line from each of the dots, you will also see that they actually only do that for the right side of the object, whereas they completely neglect the left side of the object. There are a lot of these disturbances. So these visual neglects, they often is caused by a stroke or something in the parietal lobe, and because stroke often affects a lot of areas, it's not so specific that you can say, okay, this is exactly this part of the parietal lobe that's affected, but you will see that a lot of these are related to parietal lesions, these neglect phenomenon. There are also a lot of other agnosias, or the loss of the ability to recognize specific features from the senses. So, as I told in the beginning, there are these unfortunate patients who cannot experience motion. Could be a lesion in motion area V5. There are also people who cannot see color, so it's not like color blindness, but they have maybe a central lesion in visual areas that are responsible for processing color, and they only see the world in dull gray areas.
What is the difference from that and colorblind?
So the colorblind is in the retina. So the representation in the retina. So for instance, you cannot discriminate between, let's say, green and. But they can see something. Some of them they actually say that some of the colors they look a bit. They can see colors, the colorblind, but depending on which type of colorblind it is, then they, for instance, cannot discriminate between red and green, which is the most common. And they, for instance, see purple as bluish colors, and cannot really say if it's one or the other, but they still see something that has a color. Whereas these patients, they completely lost the ability to see color. Then there are some who also cannot see faces or recognize faces. So for instance, if you ask them to judge whether two faces are alike, they are not able to do that. And it seems to be a genetic disorder. There luckily only very few who suffer from it, but it's at least something that's present. Also, some of the more disturbing is the loss of the ability to localize your own body and your orient body parts, so you cannot really orient them. And for instance, there are also disorders where you're not able to recognize objects when you touch them. So if you're given a set of keys or something, you cannot really touch or feel that it's keys. So so really disturbing for all the patients. Another feature of the brain is also that which is probably not surprising, is that there are certain areas of the brain that are responsible for recognizing bodies, body parts. So one of them is called the extrastriate body area. And you can see it's a bit difficult, but it's located here, also somewhere in the area between the temporal lobe and the parietal lobe. Well, actually more in the temporal lobe down here. But this is an area that's specific for recognizing body parts. So if you present images of bodies, you will see that this extrastriate body area will show increased activation. On the other hand, we also have areas that are sensitive to movement perception. So for instance, these parietal areas here, they are sensitive to recognizing that movements are some movements that you've produced yourself. So if you ask a subject to produce a movement and you see a video of it, and if you then use transcranial magnetic stimulation to actually inhibit this area, you will see that subjects are no longer able to recognize the movement as being produced by themselves. Whereas if you do a passive movement, so you're not doing it yourself, but somebody else is making a passive movement of your body, and you inhibit this area with TMS, you will not see an effect. So it's really specifically related to perceiving movements that you produce yourself, and then looking at control regions. For instance, these areas that integrate multisensory information, they don't seem to have this property. So if we go up to these areas, they seem to also be dependent on the fact that you produce a motor command yourself, which is then used to compare your for instance, it seems that's also related to what you had last time, that you have a model of how you expect the consequences of the movement that you produce are. Then that is maybe compared with the sensory feedback that you get, and if there isn't a correspondence, well, then you will lose the ability to recognize movements as being performed by yourself. On the other hand, if you go down to this superior temporal sulcus area down here, which also was one of these multisensory integration areas, you would see, and for instance also involved in the McGurk effect, you will see that if you present a video of a subject and then you make a delay of that video, subjects become worse in, well, the longer the delay are, the better they will be in recognizing that it's not their own movements, or saying that it's delayed movement, which is not surprising. But there it seems that the superior temporal sulcus here will actually code the difference between or the delay of the video feedback. So the longer delay you actually put in, the more this area will light up. So it's sort of detecting the how much they don't look alike, what you are doing and what you see. So again, these multisensory areas, and appears that the parts of the basal ganglia show the opposite effect. So